Hello, my name is Morag Hearty. I'm the Programme Manager for the Technology Enabled Care Programme in Lanarkshire. That's usually called TEC. It's an NHS Lanarkshire programme, however we are hosted by the South Lanarkshire Health and Social Care Partnership. Just to start off, I think in the last few months in particular, we've noticed a real digital revolution. While technology really is touching every aspect of our daily life, from our internet banking to booking our holidays to our internet shopping, which I'm quite sure we've been all quite comfortable with recently, and then of course keeping in touch with our families across the world. However, from now on, we had our COVID came across in March of this year. That hit us and we had to think about what we were doing. Underpinning all of our technical and digital innovations that we've been carrying out in Lanarkshire, which we have been doing for a few years now, we absolutely had some key principles, and those were the same for COVID and the COVID response. That was not just to put something in as an emergency, but improving that patient experience. We knew already that it could reduce the travel and costs, and how much more important was that to people living away and their carers. Providing a more convenient access to services, and we already heard from our patients, our families and their carers, how this could make a difference to them, not having to go out in the rain, not having to hassle to car parks. And actually we knew clinically that they could actually monitor some of their conditions at home, and that was actually more effective and a much better way to do that, and they maintained this, and I'll tell you a bit more about that as well. So we optimised their control of their condition. They knew more about what was going wrong with them, or what was best for them, what it meant to them. And of course with COVID, the most important thing in some aspects was actually reducing that exposure to infection. So we were all very, very aware of trying to reduce that footfall where we didn't have to, leaving space for those who did have to go to a hospital or a clinic setting. Lanarkshire Near Me, that was the programme that we changed the name to, changed to a corporate Scottish Government branding called Near Me. It used to be called Attend Anywhere. It's exactly the same programme, just got a bit of a brand change. And you can see there that how fast we've actually moved this. In February, we were running about 74 video consults, between 70 and 100 consults a month. COVID hit us, and from the 1st of March until currently, we're running at 1,800 video consults per week right across the Lanarkshire Health and Social Care Partnership, with a number of services that I'll tell you more about as well. So really a rapid implementation, a rapid rise. We really rolled that out, and it has been very warmly received, and we'll tell you some more about that later as well. Current services. Now this is a very small snapshot of the over 100 waiting areas that we have set up, and services we have helped bring on board the use of Near Me video consults in their everyday contacts with their patients and with their service users. The top 6 at the top there, they're in red, but that's not because they're in red for danger. Those are our top, top of the leaderboard, if you like. Our GP services, that was all our GPs very quickly. They were a priority, and we set them all up with access to Near Me. And it was actually better doing it with a Near Me appointment for some aspects, because the patient hadn't got terribly distressed trying to rush and park the car and been so out of breath that they actually couldn't take their treatment when they got into the clinic. Kilbride Hospice and Social Services, these are services that are relatively new, but it's just to show that we weren't just concentrating on health, we actually included our partners and some of our third sector partners as well. Some sort of frequently asked questions here. There's some really nice wee animations and information there on that webpage, the link that you see there for Near Me. It's a national site. And there's just been recently added a signed version of that animation. So we're really trying to be inclusive. That's on the national site, lots of information there for you to have a look at, including being able to take a test call. Importantly, and something that I get really quite excited about, and I've said from the get-go, is the fact that we can actually bring in up to 4 to 5 people in this call safely and securely, with the usual permissions, of course. That means that a carer or a family member can come in the call and hear what the doctor or the clinician or the service person is actually telling the person at this point of the contact. So that saves everyone trying to take time off their work. And particularly in COVID times, that was really important because it meant that families could still stay in touch with what was happening with their family member or the person they were friends and family that were caring for. We're doing some work at the moment with our front door and our what we call the back door for discharges, and how much easier is it going to be if carers and family aren't trying to get time off their work or get up to a hospital. It's been really, we're trying to reduce the footfall, but they can still be really involved in that discussion about the care and what's actually going to happen when someone goes home. We've had carers or families going out to a patient's home to actually show the hospital staff, this is what it looks like, and the patient can see that as well. And this is what we're proposing, that we can actually change this roundabout, or we'll get a bit of equipment in there to help keep someone safe. You go into a private waiting area, no one else can see you until the clinician brings you in, just the same way as you would go into a waiting area in a hospital and then get called in to see the doctor. The costs, we've never said this is free, it is free to use, however the costs will be a data. And I've said there it's a film download, however I have been reliably informed with my eHealth colleagues it's similar to watching a YouTube video, because some films will actually use quite a lot of data. So we do recommend that people actually try and use their internet at home, or they use a free Wi-Fi if they're able to. As I say, it is secure, so they can use that. And as I say, it's secure because no data, once the call's ended, everything's wiped out. So your phone number and everything else just goes completely. And I said before, that Near Me web page is really a useful resource for you to go in and have a little look around if you can. The scale up blood pressure, I wanted to just quite quickly say something about. We have been for a few years now using remote monitoring, and a remote monitoring system called Florence. It's text messaging only. However, did you know that 30% of all adults in Scotland have high blood pressure? And only 27 of those, 27%, that's just over a quarter of those people with high blood pressure, actually have it treated and controlled below the minimum recommended levels or state that it should be in. And that equates at the moment, even with that, to 1.2 million appointments with our GP practice, just for the blood pressure check alone. So what we did was we brought in a system where the general practice or the nurses could give the patient a monitor away with them and send in that reading. And we had already done this and started it to ramp it up just before the COVID hit. Of course, it went a little bit quiet just at the initial stage. However, those that already had their monitor were able to continue monitoring. And since we've started to stand up the GP services again, we're seeing a real increase in our GPs being able to use that and want to use that. It's a way of them helping patients manage their blood pressure without them having to come into the surgery. So historically, you'd have been told, come in and keep coming in, and if your blood pressure's up a wee bit, come back and get it checked. Get given a monitor and some instructions away home with you. You text it in, you're sitting in your own kitchen or wherever you're comfortable, nice and relaxed, and then the nurse or the doctor can actually see a report that will come in and help them manage your condition with you. Over 90% of our GPs in Lanarkshire have been given access to this system. That's important for carers as well, because how often are you trying to huckle someone into the car to take them to an appointment just to have a blood pressure check? How often can you manage to look after your blood pressure and your health? And I think for Near Me and the remote monitoring, this is just as important for families and carers to look after their own health and help them look after their own health without adding to the stress. We've had lots of opinions, and don't just take my word for it. Here's some of the feedback we've had for both Florence and the Near Me service, and I think I will call out one or two. We've already spoken about being able to fit the appointment into their working day or their time of looking after someone else. Dads, when the breastfeeding feed were using it, the team are using it, the dads are enjoying playing the cameraman and mums are happy that they're also hearing and taking that information, and that just goes back to what I was saying about people being involved in the consultation. Feedback has been overwhelmingly positive. Yes, sometimes there's a bit technical difficulties. We had the older man out of hours who just said, this is just fantastic, thought it would be really quite difficult, but it was so easy. And the most recent one there was we did have from a GP that just said, this has been a lifesaver for us. It's actually helped us look after our patients. And while we recognise that some face-to-face consultations will always be required, services are recognising that it is an invaluable resource to offer patients, give you the choice and give their families and carers the choice of how they can interact with our services. So thank you very much indeed for your time, and I'm more than happy to take some questions, but I will point you, those links there will take you to the Near Me website. The animation is about the Florence, the blood pressure and remote monitoring. And indeed, we have our own web page that is talking about it has the waiting areas that we use for Near Me, and it's got other information there. So if you're having an appointment, that's where you can go and go into your waiting area. We are on Twitter, so please do feel free to get in touch with us. And indeed, that's our tech programme number. So thanks very much. Thank you.